Module on number needed to treat and harm. This video is a part of our series on epidemiology and biostats. My name is Dr. Wahab Fazal. Now let us get into it. So the first thing that we're going to talk about is absolute risk reduction and attributable risk. Both of these concepts are very important for you to understand in order to calculate the number needed to treat and the number needed to harm. So when we think about absolute risk reduction, you need to think about number needed to treat with it. Number needed to treat with it. Why? Because both of these calculations are associated with a drug, with a medication, something that decreases the risk of you developing the outcome. Something that in the outcome in this case may be a disease. So you just remember, drugs absolutely treat the patient. Drugs absolutely treat the patient. You want to absolutely reduce the risk. So when you have a drug or a new medication that is being tried on to see if it improves the chances of the person developing the disease, so the person develops the disease now has lesser chances. Let's say we've developed new drugs called X, and that reduces the chance of you developing lung cancer. So we want to know the absolute risk reduction, and that absolute risk reduction will help us calculate the number needed to treat. And that is why I need you to remember, drugs absolutely treat the patient. The other thing is attributable risk. Attributable risk is very important for us to calculate the number needed to harm. Both of these things go together. Absolute risk reduction and number needed to treat go together because drugs absolutely treat the patient. Attributable risk goes together with number needed to harm because one of these calculations is necessary to calculate the other. And why is attributable risk and number needed to harm important? Because both of them works for a carcinogen or a toxin or something bad, something like smoking. So this is like a cigarette. Smoking increases your chance of developing lung cancer, increases your chance. Therefore, you calculate the attributable risk for it and then the number needed to harm. Simple as that, nothing more complex. Now the equation for number needed to treat and number needed to harm, you need to understand the equation for attributable risk and absolute risk reduction. If you get those correct, you can easily calculate both of these values. Remember, what's the formula for attributable risk or absolute risk reduction? Well, it's always minus the risk from the group that has the bigger risk. Let's say if you're comparing smoking risk for lung cancer, one group, the smoking group, and we compare the risk for lung cancer with placebo or non-smoking, people who don't smoke, and their risk for developing lung cancer, So you minus the smoking group, you minus the non-smoking group from the smoking group, you keep this first and this latter, and you get attributable risk. If you do the same for a new drug, for example, if you do the same, let's say we develop a new drug and that reduces your chances of developing lung cancer. Let's say that is drug X and it reduces your chances of developing lung cancer. This is the smaller risk group now. And the people who didn't get this drug or the placebo group will have a higher chance of developing lung cancer. So this group will come first. And now this equation gives us absolute risk reduction. Remember, the formula is exactly the same. Just remember, you minus the smaller risk group from the bigger risk group. We'll understand this with the help of an example. But what's the difference between attributable risk and absolute risk reduction? Attributable risk is for a toxin, a carcinogen, smoking, something bad. And then in this case, the bigger risk, which group has the bigger risk? The exposed group, the group that is getting the toxin, that is getting the carcinogen. Therefore, it's always going to be exposed minus unexposed group. That will give you attributable risk. And in absolute risk reduction, you have a drug, you have a treatment, you have a medication, you have something protecting you. And what would that lead to? In that group, the bigger risk group will be the untreated, the unexposed. So the formula for this becomes unexposed minus exposed is equal to ARR. Remember, this video is for the calculation of number needed to harm and number needed to treat. And now we will get to how to calculate number needed to harm and number needed to treat. Let's take an example first. A randomized control trial evaluates a new antibiotic in a hospital setting. You can take a minute to pause this and solve it yourself if you want. So a randomized control trial evaluates a new antibiotic in a hospital setting. The study includes thousands participants in the intervention group, thousands participants in the control group. In the intervention group, 150 developed hospital-acquired infection, while in the control group, 250 patients developed the hospital-acquired infection. Based on the results, what is the number needed to treat to prevent one additional hospital-acquired infection? So first of all, I want you to understand one thing. So we are trying on a new antibiotic, and we are trying to see if it reduces the chance of someone developing a hospital-acquired infection. Therefore, this is a treatment, this is a medication. What would be? We would take absolute risk reduction. You take the value of absolute risk reduction. First of all, right off the bat, can you tell me which group has the higher risk, the exposed group or the unexposed group? In this case, we can just calculate that together. So the risk in the exposed group is 150 by 1000 or 0.15, and the unexposed group is 250 by 1000 or 0.25. So the risk in the unexposed group, people who did not get this new antibiotic, is actually higher, just like we said for absolute risk reduction. So how do you calculate this? Well, you just minus 0.1 from 0.25 and you get the value of 0.1. So how do you calculate number needed to treat from absolute risk reduction? Well, you just divide 1 by absolute risk reduction, and that is the simple formula of number needed to treat. Remember, drugs absolutely treat the patient. Drug absolutely treat the patient. Therefore, you get absolute risk reduction along with number needed to treat for drugs, for medications. Therefore, you just divide 1 by absolute risk reduction, which in our case was 0.1. 1 by 0.1 leads to 10, and that is the number needed to treat for this question. This is a very frequently asked question on the boards. Therefore, I want you to remember this, and it's very, very simple. Let's do the same once again for the number needed to harm. So now you can pause the video here and try to solve it yourself and then get back to me. So a prospective cohort study investigates the association between exposure to benzene and the incidence of AML. Right off the bat, you know this is something bad. This is something bad. This is something bad. And we want to see the development of acute myeloid leukemia. The study follows 2,000 benzene-exposed workers and 2,000 unexposed workers for 10 years. At the end of the study, 80 cases of AML are reported in the benzene-exposed group, while 20 cases are reported in the unexposed group. What is the number needed to harm for benzene exposure in this population? So what do we want to do first? Well, we want to calculate the risk in the exposed group and the risk in the unexposed group. So let's do that together. So the risk in the exposed group is 80 by 2000 or 0.04. The risk in the unexposed group is 20 by 2000 or 0.01. That means this thing which we are exposed to is increasing the chance of someone developing AML, because 0.04 is definitely higher than 0.01. Therefore, this is a toxin, this is a carcinogen. Whatever value we'll get will be called attributable risk, will be called attributable. This relates to attributable risk. So we just minus 0.01 from 0.04, and that will give us 0.03. So how do you calculate number needed to harm from this attributable risk? How do we calculate this? Well, again, you just divide 1 by attributable risk, which will be 1 by 0.03, which will give us the value of 33, Remember, drugs absolutely treat the patient. Absolute risk reduction helps us calculate number needed to treat, and it works for drugs, things that improve the chances of someone not developing basically the outcome. And number needed to harm are for drugs, carcinogens, and they are calculated from attributable risk. And now I'm going to give you a brownie point question. This is a slightly more difficult question. You can pause the video here and try to answer this yourself. So let us do it together now. A new broad spectrum antibiotic, so we know this is a treatment, is introduced in a hospital for treating pneumonia. A clinical trial is conducted comparing the new antibiotic to the standard treatment. Among 800 patients receiving the new antibiotic, 120 developed the Clostridium difficile infection. In the standard treatment of 800 participants, only 40 developed Clostridium difficile infection. That means that somehow our new antibiotic is increasing the chance of them developing C. difficile infections. So this is not exactly a treatment, this is harmful. This thing can maybe considered a bad thing. This is a bad thing. Even though this is an antibiotic, this is a bad thing because it's increasing. Let's calculate the risk together. So what would be the number needed to treat or harm for this new antibiotic? And they have given this a bunch of values. So let's calculate the risk in the exposed group and unexposed group together. 120 by 200 is 0.15 and the risk in the unexposed group is 40 by 800 or 0.05. That means the people who were being exposed to this antibiotic had a higher chance of having C. diff infections. That means the risk in the exposed group is that's why higher, meaning this will not, even though this is an antibiotic, even though this was supposed to be a treatment, this is not actually beneficial and actually harmful. So therefore, in this case, the thing that we need to calculate will be called attributable risk because this is in fact a harmful thing. This is what I want you to understand. If the intervention that you're giving increases the risk of someone developing the harmful outcome, whatever that intervention may be, even if that is a drug, even if that is a medication, even if you thought this was going to be beneficial but it turns out to be harmful, now what you calculate is called attributable risk. So in this case, for this antibiotic, we will calculate 0.15 minus 0.05 to give us the attributable risk because this antibiotic is turning out to be harmful. And what would we calculate? The number needed to harm or number needed to treat for this drug? We will calculate definitely the number needed to harm for this drug because this drug is being harmful. So again, 0.15 minus 0.05 will give us 0.1 and then we divide 1 by 0.1 again and it will give us 10 and that is the attributable risk and this is the number needed to harm for this medication. Remember, medications will not always be beneficial. What I want you to remember is that when you get absolute risk reduction, for absolute risk reduction, your risk in the unexposed group will be higher because your drug medication is reducing the chance of someone developing the bad outcome. For attributable risk, because it's a drug, because it's a toxin, because it's a carcinogen, because it's something bad, it increases your chance of developing the outcome. Therefore, exposed group will be bigger, just like in this case. So remember, bigger risk minus smaller risk will give you either attributable risk or absolute risk reduction. So what's the takeaway from this lecture? Absolute risk reduction is for drugs and treatment and they absolutely treat the patient and therefore what relates to this is number needed to treat. Risk in unexposed group is greater because they're not getting the medication. Attributable risk is for drug and carcinogen and the risk in the exposed group is greater because they might develop the disease because you're giving them something bad. Remember, an attributable risk, you might still have a very harmful drug. You might have a bad drug. You might have a bad drug. And remember, bigger risk minus smaller risk. This will change depending if it's a good thing or a bad thing. The formula in its essence remains the same for attributable risk or absolute risk reduction. In both of these cases, number needed to harm is 1 by attributable risk and number needed to treat is 1 by absolute risk reduction. Simple as that. And with that simple formula, you can just calculate every problem that you get about number needed to treat, harm, attributable risk and absolute risk reduction. Remember, thank you so much for watching this video. There is always light if you're brave enough to find it. Thank you.